teach aides were incredibly careful about combating myths and providing accurate information anywhere, anytime that we can. Just being so close to the problem, what do you think some are of the biggest misconceptions have been so far? And can you help clarify some of those?
Well, where do I start? We could talk days about this
I
one,
know.
because this disease and this virus is such a slippery customer, if I can use that phrase. It's been hard. I mean, so it's not intentional that a lot of these misconceptions and myths and confusion exists. For example, early on in the evolution of this pandemic, the recommendation was that nobody should use masks. Only the healthcare workers should use masks,
Right.
or only the patients who have been actually diagnosed with this disease should use masks. A lot of that was driven by the realization that there were very few people that were infected, and most of those could be identified and isolated, and then there was a shortage of PPE, and that's why the guideline was what it was. But since then, we have learned that people can be asymptomatic and could infect you. The incubation period ranges such a wide range of time period, that there are more people that are infected than we originally thought. And as a result, the guideline now is that everyone should use masks. But even if it's a homemade mask that prevents from microparticles from being ejected or inhaled or ingested, right? So I think that's one confusing part of this public health, where we are now recommending, everybody's recommending that we use masks. Everybody should use masks as you go out. It does protect you. It protects others if you have the disease and you don't know it. A lot of this has to do with the size of the particle that may be airborne. That's the other confusion, whether this virus can be airborne or not. Early on, we believed that this was not airborne, that this was mostly large particulates that could only hang around in the air for a couple of minutes, and the distance to which these droplets could travel was a few feet, maximum 3 feet. That's why you had 3 feet of social distancing as the guideline, and then they extended it to 6 feet. And now it's believed that you could be in the vicinity and you could still be in the zone that these particulates could be. So
Could you define for our audience what airborne means?
yeah, so that's a great question. Airborne typically means that a particle that contains this virus can be in the air for long enough duration. So for example, if you aerosolize something, you spray something in the air, the particles can remain in the air for like a air freshener or whatever, can remain in the air for tens of minutes, if not more, right? So typically airborne means something that can hang around for longer than a few minutes. Typically particles, if you go to quote unquote microhydrodynamics of particles, these particles are typically in the size of range of 0.1 micron to less than 10 microns. Those are microparticles typically. The moment you get larger than 10 microns, these become macroparticles or larger microparticles, and they do fall off under the force of gravity. But these microparticles aren't subject to gravity as much, and they're the way the wind is blowing, how small these particles are, what thermal currents might be, and so on, that these microparticles could sort of float around for a while. So if you're just walking through an area, somebody may have coughed in 5 minutes back or 10 minutes back, you could actually come in the contact of that. Likelihood of that is low, but it is non-zero. That is why we're recommending that everybody should use masks. So you can start to see how all of these sort of different behaviors of this virus actually influence the choices you make around public health policy with masks and things like that.
Absolutely, and it makes a lot of sense now why everyone should be wearing a mask of some sort to protect themselves as well as everyone else around them.
Absolutely, absolutely.